Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Ovarian hyperstimulatory syndrome. In ovarian hyperstimulatory syndrome is a complication of assisted reproductive techniques. All ovulation inducing drugs either directly or indirectly increase the follicular stimulating hormone. A number of follicles stimulated and each follicle releases 150 to 200 picograms of estrogen. Total estrogens of more than or equal to 3500 picograms. If the total estrogen becomes more than or equal to 3500 picograms, then there is around 1.5% chances of ovarian hyperstimulatory syndrome. If the estrogen becomes more than 6000 picograms, then there is 40% chance of ovarian hyperstimulatory syndrome. If you give a HCG injection, on giving HCG injection, follicles rupture and they release follicular fluid containing inflammatory mediators. Vascular endothelial growth factor is the most important mediator of ovarian hyperstimulatory syndrome. The most important trigger for ovarian hyperstimulatory syndrome is injection human chorionic gonadotropin.
thank you and thank you for watching.